expertise.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you, sir.
Mysorean by almost birth. I'm proud to be a person from Mysore, a city of palaces. I really wish everyone should be proud of their place. And whenever I go to any place other than Mysore, I always carry a few photographs of Mysore city. People always feel nice and happy to see these things. I got a very peculiar attitude, I would say, since childhood days. I like to see beauty in everything. One of the classical ones being one of the world-known Mysore Palace. It's a wonderful, beautiful monument. Same thing seen at night looks so gorgeous. So my attitude is, can we make things which appear good, better, and can we make them the best? People can always remember. So this is my philosophy, both as a teacher, as well as a medical personnel, that is a doctor, and to some extent surgeon. I'd like to see the people in the society, not necessarily patients, everybody in the society, to be happy and beautiful in all aspects, physically, mentally, socially, psychologically, spiritually. Little effort from our side definitely makes them a little happy. After we don't need to do too much of anything. Little concern, little care for them. So this is my philosophy since childhood. This led me to whatever I am today. And I should be grateful to Professor Shamsundar Madam for giving me opportunity to share, I would say, little experience of mine since about 50 years of my profession, including my graduation days. As introduced, I'm a professor and head of the Department of Anatomy, still continuing. A new medical college is being established from next month onwards at Mauritius, and I've been appointed as a Professor HOD. Earlier in Mysore, I was the Professor HOD of Anatomy as well as the Dean, Faculty of Biomedical Sciences, which taught other courses other than medical, that is BSc courses, MSc courses, PhD courses, and so many others. It is me. So I belong to one of the very prestigious institutions in Mysore and in Karnataka, which has had quite a good niche. Even in India, a lot of students prefer to do graduation as well as post-graduation in this because every department has been designed and the faculty are really dedicated and committed to teach their respective subjects. In the hospital, it's got all specialties and super specialties. Patients are
5,000 rupees.
cost.
Sir, one minute. Sir, Siddhappa sir. Sir, mute ಮಾಡಿ.
One
Yes,
of my
sir, please.
passions is museums. Since my childhood days, I used to collect some butterflies, some plants, some flowers. Show it to my friends, maybe relatives too. They feel happy. Talk about it. So this is the philosophy, sharing the happiness, sharing the knowledge. Even today, I continue to do that. One of the best museums, one of the largest museums in India, is not just meant for the Department of Anatomy in a medical college, but it is open to public. Very few medical colleges have museums open to public. One of them is KMC Manipal also. Much bigger, almost every week, we get students, high school, PUC degree, sometimes even visitors to Mysore to see the museum. Either myself or my colleagues take them around like a tour, educate them about the different organs, different health issues. We not only have normal organs like a brain, heart, lungs, liver, and all that, we also have specimens of different diseases, including the tumors and cancers. So selectively, some people want to know something about a particular disease. Take them to a particular area, explain to them, tell about the causes or the complications that can occur. So they're very happy. almost every week, one or the other schools from Mysore and around Mysore come. Even I'm very proud to say that even from distant places, only last week, people from Bagalkot, one of the government schools from Bagalkot, had brought, it was a part of the Mysore tour, 123 students, both boys and girls. One of the visits was the museum visit. So in that way, being a doctor, I feel it is extremely important to have a good amount of knowledge, basic knowledge about our own health. Because money is not happiness, assets are not happiness, health is happiness, health is wealth. So I really feel everyone should be aware. Second thing why I'm particular about the talking, giving a talks, maybe I would have given hundreds of talks also at different levels, school to colleges to different institutions and organizations. Very unfortunately, I feel a little bad also. People neglect. Most of the time when I go to different institutions, particularly schools and colleges, I tell the students, when your mobile is out of order, is not working properly, you become so restless. You run around the city that if it's a holiday or a Sunday, you search for a repairer, go to that fellow, pay a little extra, get it repaired. Oh, now it's working all right, as though life was going to end. Similarly, our vehicles, scooters or cars, something out of order, we are so particular. Why do we neglect our own health? It is so precious. Many times I see patient coming to me. It may be simple cold cough fever after 2 days, 3 days. People coming to me with a swelling or a tumor, including cancer, after many, many months and years. More than that, I feel very odd, awkward, because every day counts. Even have operated cancers under local anesthesia, giving an injection, making that area numb. Even after 30, 35 years, the person is alive. More than he or his family, I'm proud, I'm happy. Because even cancer is curable in the earlier stages when it has not spread to the other areas. So my humble request to all the teachers and indirectly through the teachers, to the students, to their families, to the society in general, impress upon them, do not neglect health. Whatever the disease today will not be the same tomorrow. It will be much more complex, complicated, aggressive. Treatment is simpler, easier, cheaper when treated in the earlier stages. So when Madam Shakuntala asked me whether I could give a talk, I said extremely happy because teachers are the ambassadors, not only for the students, to the entire community. So I represent 40 plus people. So through you, my little knowledge of medicine and health can spread to thousands of people. So that's my request to all the teachers here. In addition to being a professor, HOD, and others, instead of even spending chit-chatting with others or roaming around or watching a TV or looking into some funny videos in a mobile, I thought let my knowledge be of some help in the evenings. I hardly rarely go to movie. So evening, since about 43 years, I'm having a clinic, what we call as a family practice. I'm a family physician. When I started 43 years back, 10 rupees was a big money. I'm sure all of you will agree. 10 rupees what? Because people, when I said 10 rupees, they used to pull up 10 paisa, 5 paisa, 25, 50, 1 rupee and all that. I have a handful of this. I was feeling bad. I have a salary, good enough for my simple living. Should I take coins pulled together to form 10 rupees from a patient? Then I realized giving free anything, even if you give gold and diamond free, it has no value. And I thought, okay, I'll give equal or even more quantity of medicines for the 10 rupees. So still continuing after 43 years. Because people should not say Shamsundar has become greedy nowadays. Earlier he was charging only 10 rupees. Now he's added one more zero to make it 100 rupees. No, I don't want to. Anyway, I'm happy they are happy. And with that money, I don't need to buy one more car. I have a basic scooter and car. and good family and everything, right? So satisfaction is one of my passions. I feel people should have that word, satisfaction. Many other times we see people are unhappy because of the greed and absence of satisfaction. In 1982, I had the privilege and honor of working in the government hospital, so-called KR Hospital, Children's Department, in the pediatric surgery department. And I had a wonderful teacher and my professor HOD, pediatric surgeon, Dr. Gopal. He was so happy and encouraging to me. He taught almost all types of children's surgeries. Maybe very few guides or professors teach the juniors. Many of them are jealous also. But he taught me, or he gave me opportunity to do 2,000 surgeries. Right from the day one, today morning the baby is born. By afternoon, we have to operate. It's a very serious birth defect in any part of the body. There are hundreds of diseases. So we had to convince the parents who feel shocked when we say a newborn baby has to be operated, that is a major operation, they cry. But we explain to them, convince them, saying that if not operated today, you'll be losing the baby. So finally they agree, we operated, and next morning I see a wonderful smile in the face of all the family members. Maybe the baby would have also smiled, but it's too small. So in that way, I had the opportunity of operating more than 2,000 very complex children, and many of them, in fact, came for checkup, and they were so happy. And very funniest thing is, after 10 years, 20 years, 30 years, people meet me and they said, you are the one who had operated on me. I don't remember, I was too small a child. My mom used to say, my father used to say that I had some problem and you were in the children's surgery department, you had operated. It's me today after 20, 30 years. So wonderful, isn't it? Somebody remembers you or has gratitude and they are healthy and fine. What more you need? It's not the money. Incidentally, to make myself happier, cool, relaxed, because our profession is full of unhappiness and sufferings and things like that. So we also try to keep our mind and brain cool with many hobbies. I'll talk about the hobbies a little later. And being a children's surgeon and a person respecting the children, how beautiful children are, different categories, different attitudes, so innocent, so wonderful. I like children because they are innocent. They don't have any of the bad characters. As they develop bad characters from people like maybe you, me and you. I would say you and me. So it's my small clinic. I had a museum of different organ specimens, including the tumors and other things I had operated. Now it appeared too small. Now I've opened up a little bigger museum, much larger museum in Mysore. And incidentally, it happens to be the only museum in India about health, unique health museum, Vishishta Arogya Sangrahalaya. Hundreds of students from different schools, Kannada medium, English medium, government, private schools visit. Some of them come in 2 buses, and I take them around the museum, explain to them, tell about the complications and other problems if they do not be careful about their food habits, lifestyle, and others. And this was there. Now all this has been shifted to another clinic nearby, which is a unique health museum. A lot of patients, a lot of public also come. Is a nice thing. It comes in the media also to give publicity to this. And most of them, more than 90% of the patients are from villages. I'm really happy about them. I don't want hi-fi people coming with a printout of the internet, Google confusing printout regarding the diseases. I tell them, forget about Google. I'm right in front of you, living person. Google gives information which is more confusing to patients and IT people rather than it's only meant for a reference. Rather, it's meant more for doctors than for the public. You put a Google search a headache, you'll get a simple headache because up to cancer. So people are unnecessarily put into confusion. So I really like villagers, innocent people, and at least 25 to 30 people I see. Some of them are also referred from my friends and colleagues and relatives for a minor surgery and local anesthesia. I operate also here and in another clinic. Little major ones, I take it to my friends, rather I would say my students' hospital nearby. And luckily for me, when you are a good teacher, students are also good, except here and there, occasionally the black sheep is always there. Whenever I say, call them my students, sir, how are you, sir? So nice, sir. We are proud of you, sir. We are your students and all that. Yes, sir. What is the reason you called? So I got a patient who cannot be operated under local anesthesia, and I want to bring him to your hospital and operate and go. I would like to know the charges. With all coaxing also, they said, sir, please come, we'll see. After the surgery, we'll see. And they said, no charges, sir. No, this is a little embarrassing to me. No charge means it will be difficult. No, sir. This is a minimum Guru Dakshana we can give. You had taught us, I have become a surgeon because of your teaching not only anatomy, surgery. How can I take money? No, at least take some formal amount. Otherwise, the people will start doubting you and me whether I have done surgery at all. It's all coaxing and forcing. They take a few hundreds. It's really embarrassing to me, but that's the way it is. Students always remember teachers. So I go to the hospital occasionally, very occasional, maybe 1 or 2%, where anesthesia is necessary to operate on a big problem. So being a pediatric surgeon, a few photographs I'll show you before we go to your health issues. Why I've shown this is, most of you, I was told, are teachers of the UG, PG, maybe around your relatives and friends. But thing like this looks quite scary, right? But it's such a simple thing. Around the testis, this is a male baby. Around the testis, there's a small collection of watery fluid. It's a very simple thing called as a hydrocele. Hydro is water. During their development, there was some small defect and the water got collected. And you'll be surprised. The surgery, not even a anesthesia, general anesthesia, nothing at all. The baby is usually right from the time of birth up to 3 years, 4 years, and all that. They bring different sizes. Sometimes it's the size of a small football also, maybe negligence. So they come to me, I tell them the baby anyway is going to cry when I give an injection, or when is away from the parents, mother and father, it's going to cry. Let it cry for 5 minutes, doesn't matter. It's a good thing to cry. Because subjecting the baby to general anesthesia, its complications, admissions, expenditure is not worth it. Then they agree. So they said a small injection, the baby is going to cry for 2 or 3 minutes maximum. After that, in the 2 to 3 minutes, the surgery is over. It hardly takes 2 minutes. Open that area, there's a fluid, drain the fluid, put a stitch, close it. After 2 minutes, when the baby has stopped crying, add the mother to come in and collect the baby. So it's a very simple, quick surgeries. So such things need not create any tension or anxiety among family members. Many times we get children born with the defect. I call it as a manufacturing defect. So both the fingers are united. It needs separate fingers are necessary, not only for wearing a ring, but so many other purposes. In fact, I had a very, very cute, very small boy, a Muslim boy, hardly about 3.5 years, very cute, very active, never crying. So he had a thing like this. And I told that boy, I will put a bandage because the child doesn't understand injection, operation, and all that. He said, agreed. One thing, you should not cry. If you cry, I will give injection. If you don't cry, I will put a bandage. He said, okay. So with a very, very, very small needle, insulin needle, I gave an injection. The baby didn't even cry. It was so small, it didn't even cause pain. I gave the injection under local anesthesia. I separated this. 2 fingers were separated, and both of them were stitched separately, and the fingers got separated. Last second was a very nice experience for me. It looked at the fingers, moved the 2 fingers separately, and looked at me. What magic have you done? They were moving together. Now suddenly they have got separated. Some stitches or something like it. There's a bandage also separately. What did you do for them? It had a mixed feeling of smile, happiness, and curiosity looking at me. So nice, isn't it? When the patients react like this, it looks so natural. The baby has a little larger side mouth on one side. It has to be made symmetrical. So this also can be done with local anesthesia. Baby's face looks beautiful. Quite a complicated one. Inside the brain, outside the brain, there's a collection of watery fluid called cerebrospinal fluid. It is dangerous to the baby. It can compress upon the brain and it can land up in paralysis or even death. So, of course, it's done under general anesthesia. We put a tube which drains all the excessive amount of cerebrospinal fluid present inside the brain, outside the brain, and is drained into the chest or the abdominal area. It gets absorbed into the blood. And after a few months, the baby becomes all right. So these are life-saving diagnosis and surgical managements. Some babies come like this with a tumor, again a birth defect. There's a small balloon-like swelling filled with a fluid. Carefully, under anesthesia, we separate that and finally remove that and stitch it, and the baby becomes all right. So like this. See this girl, I feel so sad. Why do I feel sad? She looks so smart and smiling, isn't it? But unfortunately, we know the problem. That's why I feel so sad. Normally, the human beings contain 46 chromosomes inside a cell. Extra is always dangerous. It has got 47 chromosomes. 21st number is called a Down syndrome, Mongolism. Being extra, having additional things also is dangerous. In the school, I make sometimes jokes so that the students who are seriously listening and a little tensed up, looking at all the diseases, make a joke. Extra mobile with you is always advantageous. One mobile is charge has come down, is not working, network is not there. Second mobile is good. So one more refrigerator, one more washing machine, one more cooking range, one more husband, one more wife. Last thing they understand the joke, it's no, sir, that's not good. See, that way extras also can cause a lot of problems. The brain development is affected. Heart defects can be there. Hearing problems, sight problems, very difficult. We cannot take out the chromosomes from trillions of cells. So we train the parents to take care. It cannot even speak after 10 years. It cannot tell its name. It cannot take its bath. It cannot eat. So sad, isn't it? Down syndrome. Very unfortunate, this happened about 36 or 37 years back. This was my first year student. Just 10 minutes before the delivery of the child in one of the private hospitals, where my professor was involved in taking care of this delivery, suddenly both the babies died. Just 10 minutes. They had passed 10 minutes of today, both would have survived. They tried very seriously, but nothing could be done. Reason is unknown. They had to take out the babies by cesarean. Very well grown, beautiful babies, twins. Chest was attached to each other. Both the babies had a common chest. We don't know whether heart was common, lungs was common, but it died. We didn't open it because it was a very precious one. How sad, isn't it? 9 months of pregnancy and expectation for beautiful, healthy babies. Last minute, something crashes. Yes, this girl was 18 years old. 36 years back means you can understand she must be 50s by now. She would be a doctor. She said, I would like to hold, sir. Please take a photo. So now coming to your areas. As I mentioned earlier, it's not only your health, your family health, your colleagues' health. Since you are involved in hundreds of students, so a good health knowledge about the health preventive aspects, some of the common diseases, which you can probably guess when the student has some complaints, does not come to class and finds some confusion. They can always talk to the student, try to find out what could be the cause, and most important, you are the people. Tell them, convince them, no, don't neglect. Today only you go to a doctor. Or if you are feeling really sick, we'll arrange somebody to take you to the nearby hospital, nearby doctor. So that is extremely important for us. Somebody convincing and consoling the. Many times what happens, they come to school, they are not well. They say, I want to go home, call the parents, just send them up. That's fine. But getting a little more involved in healthcare really matters, because the parents may be uneducated. Parents also may not feel anything is serious. They may give some food and make the fellow sleep, and there could be a serious problem also. So in that way, being health educated, if you can discuss with the parents when they come to pick up the child or the students and explain to them this appears to be a little different, just don't go home and try to give some medicines on your own. Self-medication is a very complex issue nowadays. We find a lot of problems with that. So explain to them there appears to be some problem. Go to a nearby doctor, discuss with them, try to find out what is the problem and get it treated. And if he's fine and healthy all right tomorrow morning, send him to school. So your role in coordinating this health issues of your students is very much important. As I told you, money is not important. If that was the happiness, all our politicians and film people, business people would have been the happiest. Very unfortunately, we see they are the most unhappy people with all complicated diseases like diabetes, hypertension, obesity, cancer, whatnot. A bungalow, car, assets, certainly not happy. Many of them I get, sir, we have everything, sir, literally everything, crores together of money, but one word is missing. What is the word missing? Health. Very unfortunate, right? Maybe they work too hard or they work in a different way to gather money, but health disappears. So health is happiness. I always say, Sarve Jano Sukhina Bhavantu. And funniest thing is, it's not in the hands of the doctors or the medical fraternity or the hospitals. Even though we are blamed for whatever health issues of the country, nation, whatever, we do our work very honestly. Maybe here and there are some doctors who are after money, that's fine. But many of them, majority of them have got ethics. We are really concerned. We do our level best to see that the patient's health is maintained or disease is cured or complications prevented. All those things we do. But 100% is not the responsibility of the doctors. The patient, relatives, friends, including the teachers. So take some responsibility, share with us. We'll be proud of you. We'll be grateful to you also for many times I get the teachers bringing a child, a patient. In fact, I still remember almost more than 40 years back, both husband and wife are teachers. They brought a small girl, about 6 years must be, from their village. One of the neighbors was an ordinary farmer. He said, Master, you please take my girl child, get some education, being teachers, both of you will be useful. Otherwise, like us, we'll also be held up. The child will not do anything better. She will be stuck up with our field and all that. And who knows, the future may be still bad. So without convincing, the teachers agreed to bring the child and put it to school. And they also said, don't feel anything bad. It's like your child. You can also make the child get involved with domestic work. She has to learn. Of course, they didn't do too much of domestic work also. Next day, they came to my clinic and showed me the child. The child had a fatty tumor, what we call as lipoma, bigger than the size of a coconut. You can imagine a girl of 6 years. The head will not be much bigger, not even half the size of a football. And she had a big tumor, a fatty, luckily it's not a cancerous one, in her head. That was a lipoma. It was a very, very simple tumor, non-cancerous, non-painful. As the girl, since how long it is there? She said very long. Very long means, I don't know. It was there since long time, it's becoming bigger. They called the teachers, both were high school teachers, said this is not looking nice. Nothing is going to happen, but it looks awkward. No complications, it never 100% is not going to become cancer also. But being a girl, that to go into school, everybody looks at it, she feels embarrassed. Many people ask a lot of questions. It's very bad to have that. And I can operate. Don't worry about the money. I can operate. and to move it. They said only one, sir, we have taken this girl with all responsibility to take care of the child. If there is no complication, there is no problem, you go ahead. Because we are not her parents. We have brought her from very poor villages, from our village. So they feel nothing is going to happen after surgery, during surgery, go ahead, sir. We have absolutely, I said, absolutely nothing to worry. The girl was very cooperative. I operated under local anesthesia, hardly about 5 ml of local anesthesia. In between, I used to talk to the girl, talk about their village, talk about the parents. The girl was very comfortable. It didn't even feel the pain. It took about 12 minutes or 13 minutes. The big tumor was removed. I stitched it. The girl was so happy. I said, this is your tumor. She was surprised and shocked. No, it will go. It will not come back. No, it won't come back. After many, many years also, I saw the girl. How happy, isn't it? I didn't take any money because being a teacher myself, I said, you are doing some yeoman service. Let me also share a small thing. Of course, I didn't spend much of my money, maybe few hundred rupees or something. So being teachers, we have a responsibility. That's what I'm trying to impress. Not only in health, so many other aspects. Quickly, it's not 60 minutes, maybe less than that. We go through the different organs in our body, in between which organ is what, which organ is important, which organ does what common diseases can affect different organs. We'll just quickly have a look. Again, I believe in positive attitude. The two being doctors is very important to convince and console the patient. Nothing is going to happen. Be cool, be clear. The sentence is going to matter a lot. Okay, sir, you are telling, we are happy. We are convinced, right, about health. So even being teachers, have a very high positive attitude so that the students study very well. They come up in life, they become good citizens of the future. Self-confidence is extremely important. Build up a similar self-confidence is all your students and the community. Hey, you can do it, I say. When I can do it, you can also do it. That positive attitude really matters. I have a lot of it. Yes. Tell the students to dream big, not just getting a pass in some particular class or not even getting a first class. Tell them you should get a rank, first rank. You should get a first rank to the university. You should be first to your village or your city or to the state. Plan for that. Just a dream is not going to help. Plan for that. Many times, everybody is surprised, including the student himself, that he has achieved it. A medical student of first year used to be very naughty. I used to scold him. I used to talk to parents also. It would be too much involved in other activities other than studies. Finally, at the time of examination, things changed. He became serious. He studied very well. But he himself was not confident that he will pass the 3 subjects, difficult subjects in the first MBBS. When he results were announced, he literally ran and landed up in front of me. Literally ran like a small child. Ran and stood in front of me. I was surprised and smiled. So sorry, sir, sorry, sir. He never realized he's entering the head of the department chamber without even asking permission, stood in front of me. He was thrilled. He was shockingly thrilled. Okay, what is the news, man? You appear to be in very high. So sorry, sir, sorry, sir. I didn't take permission. I just rushed in. Fine, I'm happy. I see happiness in your face. Tell me, what is the good news? Sir, I can't believe I passed in all the 3 subjects. A very naughty fellow. Everybody was thinking he's going to fail in all the 3. He's passed in all the 3. I said, first half I said, please don't tell. It will be dangerous to you and to me also. I can't believe Miss whether Shamsundar given a pass without your good answers. So be happy. Now onwards, be a very good student. And after graduation, he did post-graduation. He's a very good surgeon. When it comes to Mysore, he calls me. Sometimes he visits me. Said, so first year you scolded me, sir. There's the one which more than what you taught. The scoldings made me change, sir. I'm a good surgeon, sir. A lot of patients, complicated surgeries I do. Even today, I always remember before making an incision, cut in the patient, I always remember your teaching at your anatomy, sir. So we teachers have got a very important role to play in the future of India. So Tell them that you can dream and plan it, you will be able to achieve. Health is wealth. Stress is one of the most dangerous things that is coming up now. Ask them to be cool. You yourself can be cool. I see a lot of teachers having a lot of stress, landing up in hypertension, high blood pressure, landing up in different types of biochemical or other diseases, including diabetes, sugar problem, landing up in confusions, sleeplessness, reduced appetite, no hunger, lifestyle changes, and most unfortunate, landing up in cancer. You'll be surprised, shocked. In long term, years and years together of stress can change the biochemical reactions occurring in our different cells, different parts, and can lead to cancer. So right from today, you see that you keep cool. Nothing is going to happen. World is not going to end tomorrow. Try to understand the situation. Try to see how best you can solve the problem, manage the problem. Take the help. Take help of your colleagues, your senior, juniors, family members, anybody and everybody. There are people. You don't need to feel you're alone. So stress is a very, very dangerous thing. More than a cigarette or alcohol, we put stress as the first one. There's any type of a disease, metabolic disorders. And one is designed, our body has been designed to live happily, healthily for minimum of 100 years. A lot of research and experiments have been done. 100 years we can happily live. Absolutely no problem. Every organ has been guaranteed. Or washing machine or refrigerator or car is not given guarantee for a couple of decades, but our body has been given. But we spoil it, we damage it, sometimes intentionally, knowingly, and we say somebody died early, somebody died of heart attack at 20 years, 25 years. Somebody has landed up in diabetes at the age of 20, 30s, which I was never heard of. Diabetes was a old age disease. High blood pressure was an old age disease. Cancer was known only for the old people. Right from the birth, all diseases appear in all age groups. So early detection, prevention is very, very important for a long. Let's see some of the important organs. I placed the heart as the one because even though every organ has got its own importance, heart is number one because without the blood circulation, without supply of oxygen and nutrients, no other organ can live. 24 hours a day, even though we may take rest, we may sleep. Many other organs do not sleep. They work 24 hours. So heart has to pump the blood. We say the person is dead, only the heart is stopped. Even if the brain partially is stopped, brain dead in accident, injury, head injuries, person can be still alive. He may be in the ventilator. He may be on the ventilator. Kidney partially dead. Both the kidneys are dead. Still the person can live with the support of the dialysis machine. So many organs can be dead or partially dead. Still the person can live. But heart, once dead, hardly 10 to 15 minutes are decreased blood supply to different organs, the person dies. So heart is a wonderful pump, very nicely kept in the chest between the two spongy lungs, very well protected, works 24 hours a day. One of the most important organs. In the schools, we make a joke saying that the boys and girls, funny dialogues, I love you from the bottom of the heart. I show the heart. In fact, I got the heart at the end. I will try to show if possible. There's no love, there's no hatred, there's no feeling in the heart. Heart may only respond to feeling, that's all. All the feeling is in the brain. So tell the girls that don't believe a boy if he says, I love you from the bottom of the heart. Everything is a muscle, a wonderful muscle, contracted 24 hours a day without a break. And it works for 100 years without any problem. But because of the lifestyle, smoking, junk food, particularly alcohol, lifestyle changes, infections, bacterial infections, heart gets damaged. Junk food, cholesterols, All these things damage the heart. This real heart, plastinated heart, you can hold it in the head. There's no smell. This heart I had made about 30 plus years back. There's no smell. I take all these specimens in my bag or in my pocket also to explain to the children, school students, how the heart looks like or feels like. They can even touch. There's a specialty, touch and feel experience. Nervous system probably is the second organ system, which is like a supercomputer controlling all the activities of every organ, controlling the heart, lungs, respiration, circulation, kidney functions, food, sleep, higher functions, happiness, sorrow, communications, memory, whatnot. But because of the lifestyle changes, is a common every organ. And most unfortunate thing is these youngsters, maybe 15 to 35, 40 years, both boys and girls, there's no difference nowadays, having the two-wheelers, going at high speed, unfortunately not even wearing the helmet, brain being such a delicate organ. You'll be surprised if I say brain is not as hard as your ragi mudde. It's not even as hard as a cake. Certainly not even ice cream. Ice cream is much harder than the cake. It is as soft as a bending, right? Curse. So such a delicate brain has been very well protected inside the skull, floating in water, cerebrospinal fluid. It does not even get shocked unless the head injury occurs because of non-wearing of the helmet. Once the skull bone fractures, brain literally flows out like curds coming out of your cup. So it's called the students, children also in the road, where you want to kill yourself. Nothing can be done. Once the brain is dead, nothing can be done. So very delicate organ, excellent organ, works 24 hours a day, trillions of nerve cells carrying out all activities very perfectly, more than the supercomputer. Yes, this is the way brain looks like. You can even see the size. The person is holding the brain hardly about 6 to 7 inches in length. Wonderful, very well protected, automatically controlling its own activities, doing the activities of sleep, wakefulness, feelings, happiness, sorrow, everything. It looks like a small bunch of organs. Same brain, living brain. Memory. I tell the students, memory is the thing which comes by your training. Even Einstein didn't have a big brain or a complicated brain. He had a brain of an ordinary common man. Because of repeated usage, just like a song. You like a song, you start singing the song. Maybe before that you listen to the song, then start singing. Then after a few times, few days, you know the whole song. So brain can be trained. There's no end to brain development. Throughout our life, it is plastic, changing. Things which you don't use, they disappear, like our computers and mobiles. Which you frequently use, it gets recorded. So use and disuse, that's all. More and more you use, more and more efficient becomes. Memory, yes, memory is nothing special. You don't need to go to memory classes. Do whatever you want to, very honestly, repeat it, automatically it comes, right? So we had a very big problem of people going for depression, khinnate. And they don't want to work, they don't want to study, they don't want to go to the office, they no work at all. It becomes a headache for themselves as well as the family members and relatives, office. And many of them committed suicide. And a team of my colleagues sat together. We said something has to be done about it. Depression is not a big problem. It can be treated 100%. But committing suicide is very dangerous. We don't know when the fellow is going to commit suicide. So we thought of collecting the brains for people who died of depression or who died due to suicide. So we took the permission from the family members. Of course, we had permission from the college, university, everything. I collected about 56 brains of different categories. We had the history. We talked to the family members also. And we did nearly more than a dozen tests, including microscopic examination, some trace elements, iron, magnesium, manganese, aluminum, all those things. We cut the brains. We did the MRI of the brain. And these are the two deep freezers. The temperature goes below -80. Our refrigerators is only 0. So each one is quite expensive, more than 4 lakhs each. So this is the second depression rank in the world. One is in Netherlands. So we have got international collaboration also. So luckily we could find out a lot of changes in the brain of these depressed people and suicide committed people. So they're all treatable. They're all chemicals. So we have a very good psychiatry department in JSS. So antidepressant drugs are available within a couple of months. The person totally becomes all right. And he asked her, was I in depression? How it happened? I don't even remember. I'm fine now. So depression is treatable. Unfortunately, people do not come to the hospital. They think they are not interested and things are going on. You teachers should identify the students who do not show interest in learning, who are in the corner, don't come to the class regularly, miss the class, not doing homework. They may be in one of the psychiatric problems. Refer them to a psychiatrist. Depression is 100% curable. Unfortunately, India is becoming number 1 in depression. America, some Chinese places, Japan had a lot of depression. Now India is voting. It's very, very sad. So we have to do something about it. Because of my team presentation, I presented in the national conference, I got this gold. Second one is the lungs. See this. Contaminated air, polluted air, or that people spend money to get the disease. Very unfortunate, isn't it? Smoking, beer, cigarette, and whatnot. A lung which is so beautiful, whitish, pinkish in color, because of the air pollution has become dark, deposit of all carbon particles, dust particles, different categories of nicotine and tobacco things. And this is the 100% guarantee for cancer. Number 1 cause for cancer, lung cancer, is smoking, whatever way. Beautiful passages, looks like a tree, inverted tree. Air goes within a second to the lungs, lungs expands, oxygen and carbon dioxide exchange between air and the blood, and air comes out in 3rd second, 3 seconds, respiration, inspiration, exchange of oxygen, carbon dioxide, expiration. Beautiful, wonderful. Can we maintain our atmosphere clean? We are polluting the atmosphere. See the beautiful million alveoli where the exchange of oxygen and carbon dioxide take place. Can't even see them, thin, smaller than hair. In 1 second, the air goes, 1 second, air comes out. In the remaining 1 second, the exchange of oxygen and carbon dioxide. Looks like an inverted tree. I prepared a cast, the plastination cast, injecting the silicone rubber into the trachea, the windpipe. Then it went throughout the lungs, both the lungs, after cleaning the lungs, and dissolved the lung, macerate the lung by putting into acid or boiling. The whole lung got separated out, and we have the cast of this. I use it for teaching the students, teaching general public, how beautiful is the space. It is not the lung, the space inside the lung. Can't you maintain this as clean, as perfect, without air pollution, without smoking? You'll be alive for 100 years. No respiratory infections, no coronas, no bronchial asthma, no allergic bronchitis. Maintain that. People get impressed. More than a dozen organs in the abdomen, different organs, very nicely packed, placed in their respective place to maintain the health of the abdominal organs. We saw the chest organs, heart and the lung. Kidneys are another very important organs. They are the housekeeping force, placed quite deep inside, under the stomach, under the liver. Kidneys work 24 hours a day. They clean the blood, 6 to 7 liters of blood, 24 hours a day is passing through the kidneys. Kidney is so intelligent, the cells are so intelligent. It molecule-wise picks up those chemicals which are not needed by us. How nice. Urea, uric acid, creatinine, sulfate, phosphate, urates, oxalates, extra amount of drugs that you have consumed, the poisons produced by the bacteria, virus, the contaminants in the air, contaminants in the food, in the water, all these are to be cleaned only by the kidney. No other organ can do it. So can't we take a good food, healthy food, uncontaminated food in the air, prevent the kidneys having overload of their work, 24 hours they work. Hard in 5 to 10 minutes, they can clean so much of blood. And all that clean one becomes a solution called urine. Unnecessarily, why do you want to tax the kidneys? Keep that healthy. It will make you healthy, right? The organ above that is the liver. We'll see that. Yes, this is the bean-shaped organ keeping our body healthy. Stomach. Yes, this is what I'm a little irritated about. Irritation. Why? My mother always used to say, ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ in Kannada proverb. ಊಟ ಬಲ್ಲವನಿಗೆ means how much of breakfast you should eat, what type of a breakfast you should eat, what is the quantity. Similarly, lunch and dinner. When I go to the restaurants, hotels, very occasionally, very occasional, and inevitable only I go. Otherwise, I don't mind inviting my friends, colleagues, or somebody, a few of them, to my house, cook myself, serve them. They always feel happy. Nice, hygienic, good food. But inevitable, number is too big. Inevitably, we have to go to hotel. When you look around, before our food has come, due respect to everybody, my comments, people eat so much. Either tomorrow the food is not available, or tomorrow they are not going to be alive. Why so much overeating? Our body is very clear, very smart. Whatever is needed by the body, whatever amount of starches and sugars, carbohydrates, it takes. What amount of fat necessary, it takes. What amount of proteins, vitamin, mineral, it takes. All the extra things are going to be either not absorbed, or if absorbed, going to be converted into fat and deposited everywhere. Why you want to stock? Your body is not a bank, fixed deposit. Eat just enough amount of food for the particular day. Keep the stomach and liver organ in a good condition. But people eat junk food, oily food, fatty food, all contaminated food, and stomach onwards, gastritis, ulcers, cancers, tobacco chewing, spicy foods. We repeat the word spicy food, which is a cause for many of the cancers. So stomach, wonderful organ, a storage organ and digestion going on. We don't respect them. We insult them. Liver is a huge factory for processing all types of food, vegetarian, non-vegetarian, carbohydrate, fat, proteins. Wonderful, the brownish liver. Luckily, an organ which can regenerate even if it is damaged. High school and PUC or degree schools, when I go offline, asking students, do you know who are Tirthankararu? Many of the Orthodox fellows say, yes, sir. We know we are from the Dharmasthala. No. Don't talk about that. They are all very great people. They are godly people. My Tirthankararas are different. Evenings, yes, they realize. Every drop of alcohol, absolutely, there's no health issues or health benefits of alcohol, according to me. With happiness or sorrow, alcohol is not the solution. Every drop of alcohol is going to kill and damage thousands and thousands of liver cells. So one can't say fine day, one unfortunate day, major portion of the liver is damaged, cells are dead, only fibrous tissue is there. It has shrunk into less than 50%. Cirrhosis of liver. Digestion does not occur, jaundice sets in, person becomes weak, he cannot eat the food, appetite is lost, all bacterial infection set in because of the decreased immunity, because immunoglobulins are produced by the liver, and end result is cancer. Very unfortunate. We are seeing a lot of patients with liver cancer. Incidentally, there is one more organ which we see after a couple of slides below. A pancreas, another wonderful organ associated with our digestive system. Yes. This is a pancreas, very great organ according to me, next to liver. It produces juices which digest carbohydrates, fats, proteins, and others. And most important beyond all these things is it produces insulin, which is so important to maintain the carbohydrate or sugar metabolism. How much of sugar should be present in different parts of the body in the blood is controlled by the insulin produced by this. Due to junk food, due to viral infection, due to lifestyle changes, no exercises, the insulin production is very drastically reduced right from the childhood days. We unfortunately see children, few-year-old children, 3 years, 5 years, 10 years, 20 years, landing up in diabetes mellitus, Madhumeha Roga, Sakkare Kayile. Small children, no family history. That's the unfortunate thing. No parents, no grandparents, nobody is having diabetes. But because of the junk food right from the childhood days, liver has been damaged, pancreas has been damaged, and insulin level has come down. And many of them are on insulin dependent diabetes. Throughout their life, they have to take insulin to sustain themselves. And the small organ in between, cryptin, present only in women, is the uterus, an organ which helps in growth and development of the child for 9 months. Yes, lot of diseases were coming. There's a huge department called obstetrics and gynecology. Lifestyles, hormonal changes, junk food, I repeat, junk food, chemicals, contaminants. We are seeing a lot of women with a lot of menstrual problems. So please note this. Any slightest change, do not neglect. Don't think next month onwards it will become all right. There's nothing wrong in going to a doctor and consulting. It costs only a few ₹100. They will definitely give some opinion, and anything going out of way can always be treated. Number one cancer in women is either breast cancer or uterus, cervix cancer. So once in a fortnight, once in a month, talk to some doctors and take a bath, touch your breast, find out whether there is any small swelling. I operate a lot. Even today morning, I had a surgery. A lady had come with a small swelling in the breast. It was, of course, not any cancer. It was operated. It hardly took about 7 or 8 minutes, and she was very happy because awareness has come, but still not complete. So breast cancers are increasing. If the cancer operated in the earlier stage before it spreads to other organs is curable. Similarly, any changes in the menstrual cycles, bleeding and other things, pain, immediately go to doctor. Don't feel shy, don't feel hesitant, don't be afraid, because thousands and thousands of women are landing up in cancer. Many of them in the late stages of cancer are dying. So it can be prevented. So bones form the skeleton, lot of wonderful framework for the body. Unfortunately, because of the traffic, because of the lifestyles, a lot of people come to the hospital right from the childhood up to old age with different types of disease of the bones. It may be fractures, joint problems, even infections of the bones. Cancer of the bone, which was very, very less, is increased. See these fractures, fast traffic, careless traffic. Muscles are the powerhouse of the cell. It's like our engine in a car. There are more than 600 muscles. Wonderful. They keep your body wonderful, healthy, clean movements. But because of the bad food habits, bad lifestyle, muscles are becoming weaker and weaker. They improve by usage. Good exercise, good physical exercise, good food increases the power of muscles. Eye is an important organ, like our video camera. This is ordinary cataract, a cloudy thing, get operated, fine. But unfortunately, I should share a small incident which I had operated in 1982 when I was in the children's department. This boy, about 3.5 years old, from a village, came to our outpatient department. I was there. As soon as I saw the eye, I was shocked, frankly. A small girl was also there, 6 months or 7 months girl, younger sister, typical village people doing some work in the village, taking care of the lands. They thought it's a cataract. They wanted us to remove the cataract and put a lens, but unfortunately it was not. I had to explain for nearly 2 to 3 days. It is not cataract. It is a tumor inside. They were not able to understand and remember also, villagers, uneducated. And when I said it is a cancer, they were shocked. It took me 3 days to convince them. I had to tell them that if it's not operated immediately, he's going to lose the other eye. Otherwise, we're fine. It was a very smart, active boy. If it's pressed to the other eye, the child is going to become totally blind and still neglected. Through the nerves, it can spread to the brain. The child is going to die. Finally, they accepted, and I operated, and the child came for many, many months. Follow-up, it was fine. So luckily it was since birth, even before birth. So eye donations we do. There's so much of a demand for the cornea. There are thousands and thousands of people waiting for this. After death, one can donate. It's not before death anyway. Ear is a delicate organ because of the present generation of students, particularly using high intensity headphones, talking to people, putting on the headphones or earplugs for a long time can damage the ear. Very delicate organs. So one has to prevent, because losing the hearing is very embarrassing in the office and student life. See, these are very small, even though in the screen looks so big. There are few millimeters. 3 millimeters, 5 millimeters, that's all. So maintenance is important. We also created a ear ossicle bank in our Jesus hospital, taking the ear ossicle from a dead person with permission. It was transplanted as a project. Yes, biggest problem I'm really bothered is the obesity, overweight and obesity problem. See these people, they just sit and eat and sit. People are angry when I make a comment, but there's it is. You go to land up in many more complications. It's like the beginning of an orchestra. It lands up in hypertension, it lands up in diabetes, it lands up in joint problems. Who knows? Changes occur, it can lead to cancer. Women in no way inferior to men. Childhood obesity increasing in India. 20% of the obesity is childhood. See this, eating and eating, no games, no play, no physical exercises. This is a problem. We show them the TV, we show them all this junk food, they get crazy and they go on eating. A boy of hardly about 7 or 8 years, go on eating. Yes. Endocrine diseases are increasing nowadays, hormonal problems are increasing. There are nearly more than half a dozen hormones, half a dozen glands, endocrine glands, what we call, each producing a very complex hormone, maintaining the whole body very perfectly. It may be colors of the skin, it may be growth and development, it may be maintenance of blood pressure, maintenance of the heart and respiratory functions, digestion, reproduction, pregnancy, everything is maintained by these hormones. But unfortunately, I repeat and repeat, because of lifestyle, no physical exercise. People just sit and watch TV morning to night, morning to evening. People sit in front of the laptop or computer. People working offline, online, sitting throughout the night. Lifestyle is changed. Sleeping during daytime, no physical exercises, hormone changes, lot of problems due to hormone changes. Please discuss with your family doctor how you can prevent so many diseases. See people coming with such a big tumor. I really don't know whether they have more patients than me. People always say, Shamsundar, I got a lot of patients. But when I see them, I find that my patience is nothing. I feel like scolding and commenting on a lady who comes with such a big tumor, because the problem is for me. To operate such a big tumor is not a joke. Small tumor is easy to operate and quick also. It takes hours together for me to very carefully remove the tumor. There will be a lot of bleeding. So I become a little upset. See these people. The lady has got a bigger tumor of thyroid rather than her head. Tumor is bigger than the women have more patience probably. This is a boy, not a girl, had it breast swelling. You can even see the redness. Very dangerous. It's called gynecomastia, where breast has developed in the male. Very dangerous. It can lead to cancer. So immediately explain to the boy, you're not going to have any pain. I'm going to remove it, both of them. Explain to the parents, get a hormone level done, and local anesthesia, dozens of them are removed. They're safe. Otherwise, if you do not operate in the beginning, it can become cancer. Male breast is more prone to become cancerous. Yes, pancreas are already shown. So for all these things, what I personally feel is a teamwork is not a team of your own colleagues, team of parents and teachers. You have, I'm sure you got a meeting, parent-teacher meetings. You can also include me as a team person to contribute to the medical knowledge. Team always. See, you have got a team of people who did a lot of work on the brain, did a lot of work on different things. All the little elderly looking people are we, doctors, scientists, computer people. All the young looking people, this is about 15 years back. Now they are not, no more young probably. There are PhD students, completed very successfully PhD at international level. They are all postdocs, settled very well in foreign countries. They do come back. Even today we discuss and do a lot of research work. So team has got a very important role in doing good things. Maybe whatever success I am is because of the team. I always give them the credit. Finally, a few words about plastinatation, which is similar to mummification. So this is a mummified baby, not a plastinated. 9 months old baby, dried up like our Egyptian mummies. The plastination is more of an art than science. It is a dry preservation. Mummies, everything is removed except the heart. But here I don't remove anything. Everything is there. It's a new technique of preservation of biological specimens. You can plastinate animals, you can plastinate plants, you can plastinate human organs. Since about 35 years, I've been doing it. Is a dry, original color almost estimated. You also, I would say 100%. Odorless, no smell at all, no foreign smell, right? Portable. Many times I take the specimens in a pocket. I show them to the students and public. Non-irritating. People laugh at me. Shamsundar may be irritating, but not this specimen. And most important, inexpensive. That's why I got the best paper award also at the international conference, because the cost was way in a few hundreds. And the second person, incidentally, first person is Gunther von Hagens from West Germany. He's also anatomist. Very expensive, thousands and thousands. So this is the only place. I'm the first person in India. So I established a museum, first and only one in India. So there's no bottles, no forming, no smell, no irritation. You can touch the specimen, you can take the specimen, cut open, you can operate on the specimen. There's the advantage. Even the blind people are put a Braille Health Museum. Visually impaired people come and they touch, they are thrilled. Last week I'd been to one of the brain schools. They were thrilled. Sir, are you sure this is real one? Yes, it is real. I'm not joking. They were thrilled. They touched the baby. To say they never touched the baby like this. The heart, the tracheobronchial cast, even the plants can be plastinated. We used to do herbarium when I was in BSc, Urology College. And I got the best paper award and as well as a honorary membership to International Society for Plastination. And we got the award in 1998 as the best program for teachers. Any organ can be done. There's a ovarian cyst. Ovary is hardly about the size of a small almond. It has become so big. We read in the papers, 20 kg, 30 kg, 40 kg tumor was removed from the abdomen of a lady. Yes, this is the one, ovarian cyst. Even the brain, inside the brain, there's a space called ventricle that can be cast. So when we do something extra out of way, we always get recognized. In 1988, I think, or something like that, I was honored to be on the cover page of a very popular magazine in Karnataka called Taranga. 134,000 copies. What a luck, isn't it? You have to pay 2,300 rupees for a small column to be printed in a paper or magazine. 134,000 copies, free. Yes. So when we do our work honestly, things come up. When you strip out the skin, there's no beauty. So these are plastinated specimens. Even animals can be plastinated. You go to schools, kindergarten, summer camps to educate about the different animals. A non-poisonous cookery snake, a rat snake, of course, deadly cobra. Ovarian cyst. Yes, I believe in a little creativity so that people can do something happy for themselves. Is my colleague. Lady is a neurologist treating the brain diseases. Husband is a cardiac surgeon. This is a marriage. How nice, isn't it? Instead of putting something funny. Husband and wife's icons. So continue to develop hobbies if you have. Encourage the students to develop hobbies. Happiness stops when you start comparing your colleagues, your students, student to student, neighbors, criticizing. No cease, no complaint, no criticizing. One boy doesn't have an arm, and the other boy doesn't have leg. See how happy. We have everything, but still we are unhappy, isn't it? So hobbies include vocal music, instrumental music, arts and crafts. I do a lot. Electricity, electronics, surprisingly funny. Being a doctor, I do a lot of carpentry work, electrical work, sculpturing. I do a lot of designing of some medical equipments, low-cost equipments. I write articles in English and Kannada. Local. I go to TV, radio. Anybody invites me, I go without hesitation. Cooking is my passion. I cook my own food. Rarely go out. Even today morning, I had a breakfast of onion uttappa. Yes. I made these two dolls. When I was in final MBBS, I got the first prize. Do something to make yourself happy. I don't get involved in as a judge to any cookery competition because I have to eat all the junk. So I become a part without competition. I was making a sakre roti. I make all these things. So nice indeed. When you come to Mysore, please give me a call. Come home. I'll be honored to take care of you. Provide a small little things. Yes, I do all these things. Yes, so nice. What? In my father's name, I instituted the gold medal to the student who scores highest marks in anatomy. Right? Traveled a few places. Yes, this should be a curiosity, right? Behind every successful man, there is a woman. Yes, there was a great woman. My mother. See the gleam in her face, very active face, very knowledgeable, not by education, by experience. She used to correct. We are five brothers, Panch Pandavas, and one sister, and all of us are grateful to her for whatever practical education he gave. Very lot of hobbies, all those crochet. She taught me the cooking. Yes, I'm grateful to her. Thank you for patience.